Thanks so much for joining me today. Can you tell me a little bit about who you are and what your roles are?
I'm Dr. Caitlin Neal. I'm a clinical psychologist, and I work for CNWL within paediatric psychology, which is working with children and young people from 0 to 19 with physical health difficulties. In the context of end of life, it particularly has involved my work in paediatric oncology, supporting children and young people with cancer and their families, and also the neonatal work, so working on the neonatal intensive care unit at the hospital.
And my name's Dr. Heather Wells. I'm a Macmillan consultant clinical psychologist working in cancer and palliative care, again for CNWL, based in the Hillingdon borough. I work alongside the palliative care teams, both in the community and in the hospital setting, working with patients at end of life and their families, and also providing support to the teams in terms of their provision of psychological support via supervision, reflective practice and input to their team meetings. And I also work in cancer at the Hillingdon Hospital, taking referrals from patients who are often receiving diagnoses that may mean that they have a much shortened life expectancy. Some people are already on a palliative trajectory at the point that they receive their cancer diagnosis through those referral pathways too.
So I want to ask you a little bit about what the psychological issues are when looking after someone who's reaching the end of their life. Can you tell me a little bit about the particular considerations?
I suppose for us as psychologists, we see our roles as bearing witness, containing distress, but we recognise that for all healthcare professionals, particularly within end of life, that becomes a day-to-day thing that we're doing. And I suppose as psychologists, being really mindful and aware of that happening and what the impact of that on a daily basis can be.
I think as psychologists we're very much trained to notice and to be very aware in that way, and to recognise when we're providing psychological support because we're psychologists. But actually I work alongside a workforce who aren't psychologists in the most part, and they are doing by far the majority of the psychological support work to the patients that they're working with at end of life. And so it's really helping them to understand what it is that they are doing and placing credence on that, value around that, so that they know what they're doing, but also when to hand that work on, to escalate that to psychological support, psychotherapists, for example, for their own well-being as much as for the well-being of the patient. But I think also there's a role as psychologists in thinking about the welfare and the well-being of the workforce as well. So supporting psychologically minded thinking, reflection, good practices around their role to help them with it and to protect them ultimately.
So I want to ask you about what some of the psychological issues might be as healthcare professionals when we're looking after people who are dying. Can you talk about some of the things that we might see and some of the things that we might feel?
I think particularly in this context, in terms of working with people who are dying, with their families, with them as individuals, it's really around bearing witness to distress in whatever form that distress takes. So it might be managing someone in excruciating pain. It might be emotional distress. So anger, fear, deep sadness. And really, I suppose, as healthcare professionals, the impact of, on a day-to-day basis, bearing witness to that distress and containing it, taking it on for ourselves, and then thinking about what we need to do to look after ourselves whilst doing that.
There's a real sense, isn't there, of holding that for our patients, whether we're psychologists or nurses or doctors. We're all caring for people who are going through that significant period, and I think we all, in whatever way, hold that, don't we? Even if we're not consciously doing so.
Yeah, absolutely. And I think we're very aware that as psychologists we're trained to contain distress and recognise that that's what we're doing. But we know that for all of our colleagues and our workforce, working with people who are dying, that may look different and it may take different forms.
And I think within that meeting with a patient, you have a role to fulfil. So for the health professional, it's holding that distress, acknowledging that distress, but then being able to fulfil whatever the purpose for your having contact with that patient might be, in a way that's meaningful for the patient, but also in the other direction, thinking about how that impacts on the health professional too. So I think we need to be very aware of the psychological issues that and challenges sometimes and benefits to doing this work.
I think it's actually interesting to think also about different times of our lives and what we can manage. I know that as a mother of young children, in the past I found it very difficult to care for young women saying goodbye to their young children, whereas I know that other colleagues of mine have been able to manage that. And I think it's important to consider that as we go through life there will be triggers that won't be there at other times.
Absolutely. And I think that those things are fluid, that you might be in a role that involves dying, and in one context that feels manageable, but perhaps something happens in your own life that shifts that balance, and then that means that that's not doable for that point in your life.
Yeah. So thinking about the workplace, can you think about and describe the kind of culture that we need to be able to maintain ourselves in this kind of work? So thinking about the workplace, can we think a little bit about the culture that is needed to be able to sustain ourselves when looking after people who are reaching the end of their lives?
Yes, I think the important thing to consider is safety. I think we need to have a context in which we work where we feel safe to be open about our experiences. The idea of psychological safety in the workplace, I think, is what we're talking about. A term that we may have heard before. And I mean, there's various components to that, I think.
And I think absolutely for me, that means being able to be open about how I'm feeling. That might be that's a particular day that was really challenging, or the week's been really hard, or one person I'm seeing is just really affecting me and really, and being able to share that with my colleagues, with my line manager, in supervision, and without fear of what that might make me look like, or that would be viewed negatively, but actually being encouraged to be open, to have that culture.
Yes, and I think that, as health professionals, we often come into our professions wanting certain outcomes. Sometimes we like to fix things, sometimes we like to draw things to a conclusion, and sometimes when those things don't happen, that can feel quite difficult, and having the safety to be able to express that, especially in the context of end-of-life care and some of the things that we work with in that specialty is really important. And I think sometimes we have to think about the training as well, because we don't always know what we what we're looking for really in our responses. What are the things that are important for us to be able to share and to talk about if we've got the context right, and we can open up and be ourselves. What is it that we need to be noticing of our experience that's both positive and energizing, but maybe sometimes more difficult? Where do we take that? What do we do with that? And training has a role to play in helping us to be more aware, more self-aware as clinicians and as people.
I think that's key, that actually either through training or through that kind of culture of psychological safety, knowing what those signs are to look out for. So being aware of, feeling really upset and actually perhaps wanting to take that to supervision to think about that more, or it might be just speaking with one of my colleagues, gosh, have you ever found that was just really hard? But having those kind of those pathways within our teams that we have those spaces to bring those difficult feelings as well as the kind of the things that keep us in these roles.
And I think having that, the range of experiences, the more formalised support structures like the supervision, but sometimes just the informal one, somebody just, bringing you a cup of tea and encouraging you to sit and have a bit of a reset before carrying on with your day is sometimes a bit as powerful.
Absolutely, yeah.
Action.
So what are some of the ways in which we can help ourselves to manage in this kind of care when looking after people who are end of life? Are you able to suggest some sort of useful things that we might remember?
I think one of the key ways, and perhaps where to start, is really thinking about boundaries. As psychologists, we use the term boundaries a lot and are trained to think about what our personal and our professional boundaries are. And I think within this context of supporting people who are dying and their families, that can be harder. So in terms of what that can actually look like, to be aware of your boundaries, it can be around firstly noticing your emotional responses to things, being aware of what is my emotional response. What's this perhaps reminding me of? Is this reminding me of my sister's the same age or my parents the same age? And is that why I'm having this kind of enhanced emotional response at this time? So I think absolutely being aware of your responses generally and being mindful of what that can pull you into. So perhaps things like, certainly early on in my career, I was staying later. I was perhaps thinking, I just need to do all of these things and then that will help and I just need to fix this. Perhaps being, not sharing intimate details of my life and really reminding myself, it can sound quite harsh, but reminding myself of what my role in this relationship is, and it's a professional relationship. We aren't friends, and that's a different relationship we have. It's a privileged relationship, but it's a different relationship we'd have with our friends or our family.
And that can be really tricky when we're experiencing someone who's very emotional and who's opening up a huge amount to us, and we're connecting to. But yes, I think reminding ourselves that we are there to care, but not on a personal level is helpful.
And I think in many ways that's the double-edged sword of working at end of life, in that if you speak to people who are familiar with that work, they will say it is often some of the most meaningful and emotional work that they've ever done, and often that will stay with them for a very long time. And that's the benefit to them. But the cost of that is it's tiring, or it's heavy, or it can feel lots of different emotions for different people. But they come together. And so oftentimes to have that richness, if you like, you have to be open to some of the costs to you of it too. And they're closely intertwined. And I think that's where the boundary, coming back to the boundary, is so important. I've had people in my own life say to me, how do you do this job? And it is very clear to me, they're not my friends. It doesn't mean I don't feel incredibly strong emotion, but I know it is in a professional role over a professional reason. And because I have the support structures in place to take that, to explore it, unpick it, it feels safe. I think as well it's worth thinking about boundaries in terms of not just between the patient and you as a clinician, but thinking about the boundary between your work life and your home life. You made reference to it a moment ago, but really being very clear to leave work, to down tools, and to go to the other things in your life to make sure that you have that balance. And that discipline isn't always easy, but it's extremely important.
Yeah, absolutely.
Cut.
So I'd like you to talk to me a little bit about what happens when the emotional cost of our work feels too high, and what that can look like and feel like.
I think there's some terms that we often hear in the workplace related to that. The ones that come to mind for me are burnout and compassion fatigue. When we're talking about burnout, I think really what we're talking about is when the demands of our job, far exceed what's possible. So occupational stress, having way too much that can be covered in the hours that you have to do, and sometimes a change of job in those sort of instances would fix that problem if you went to a better job. But compassion fatigue is something slightly different. This is the emotional cost, if you like, of caring for others. And this is something that can accumulate over time. The thing that's important to remember is that it is reversible, it is manageable if you're aware and thinking about some of the things that we've already discussed today. And for others, if you're caring, some of the signs of compassion fatigue could be subtle, they could come, they could go, or they could grow over time. But they might include feelings like feeling helpless or hopeless, feeling that you can't cope with your role. Sometimes people say that they feel less empathy when they're with people. Feeling maybe detached or numb, or maybe a loss of interest or difficulty concentrating in your role in the way that you would normally. Sometimes people say that they have physical symptoms as well. They feel symptoms of headache or aches, pains, things like that.
Or over emotional, crying a lot.
Yeah, absolutely.
Yeah.
Absolutely. So I think it's about noticing those signs and those signals and considering, is that normal for me? Is this unusual for me? And taking them seriously and recognising them early, because then you can do something.
So, having worked in palliative care myself for 10 years, I've certainly experienced some of the things that you've just mentioned. And I just wonder, as psychologists who've also worked in end-of-life care, whether you can talk a little bit about your own experiences and when you've struggled a little bit and how you've navigated that.
I've absolutely experienced this. I think whatever language we use to describe what it was, whether it was burnout, whether it was compassion fatigue, whether it was a combination of everything. Particularly for me, I was working in neonatal intensive care unit, and like you'd spoken earlier about the double-edged sword, that work was the most meaningful work. It was really important to me. But actually then something shifted in my own life, in my personal life, and that balance fell out in terms of all of my usual ways of coping weren't working for me. So what I was noticing for myself and what other people might notice was becoming incredibly distressed by some of the work. So like we spoke earlier about those kind of noticing your boundaries, noticing what's your emotional response, that kind of leaning over into being upset after leaving work, not being able to stop thinking about some conversations or some of the people I was seeing, becoming, I suppose, kind of withdrawing perhaps from my usual support systems, which would normally be kind of being with family, being with friends. I wish it were healthy things like exercise, but it never has been. But I really noticed a difference in how I was responding. And it was just that certain life event that had happened at that time, for me, made it impossible to continue. So the things that I did, I was grateful that I was able to notice those signs. I knew that wasn't right for me. I went through the process of, I think you can feel really guilty. You can feel, you kind of internalise, is this because I'm a rubbish psychologist? If somebody was just more resilient, would they be able to cope better?
Yeah.
But actually knowing myself and knowing what these signs were, I was able to recognise that and raise that with relevant people. So speaking through with my line manager and actually inevitably coming to a decision that role at this time of my life I wasn't able to continue it.
I think there are other times as well where it can be maybe more on the cards that things might be difficult. I have worked in palliative care for many years and continue to find that very rewarding and difficult at times. But I do hold very much in mind that should my parents reach an age where they start to become very unwell, and a lot of the themes that I see at work start to mirror that in my own life, I do ask myself, how will that affect my my ability to cope? How robust will my boundary and my resources be? I don't know that it will let me down or be difficult, but I'd like to think that I'm sort of holding it in mind, shall we say.
Really important for that awareness. Really important, and to not feel guilty, as you say. Thank you very much. So it'd be nice to think about a message that we could all hold on to when we're doing this kind of work. Is there any advice or any kind of simple message that you could leave us with?
I think for me it's just a reminder that this work is incredibly meaningful, but that it's also emotionally hard work, and I don't think we often give ourselves enough credit for that sometimes, of the toll that might take.
But reminding ourselves that we're human, and with that will come the experience of emotional intensity, strong emotions at times when we're undertaking these roles. But if anything, that's appropriate, that's to be expected, it's what we want. One day, if we worked with someone who was very sad and we felt nothing, that would be the concern.